A lot of people are worried right now that if they develop fever, it could be COVID-19 infection. Symptoms of fever, chills, body aches, and cough can be nonspecific. These symptoms are all seen in the flu, cold, other viral infections, and also COVID-19. So how can you spot the difference between these diseases? I will share with you some important clues. This isn't 100%, but it can give you an idea. Let us look at 4 diseases with overlapping symptoms: COVID-19, flu, cold, and allergy. Number 1, COVID-19 infection. Some of the symptoms of COVID are similar with the flu and cold, such as fever, tiredness, body aches, and pains. However, there are other clues that may be present that will point more to a COVID infection. Number 1, loss of taste and smell. Number 2, absence of runny and stuffy nose. Number 3, presence of diarrhea. And 4, the illness has been there for more than a week. If there are many cases of COVID in your area, then the chances for it are higher. So why are we concerned about COVID? The mortality rate for cold and flu is very low, but COVID-19 can have a 1 to 2% mortality rate. In those over 70 years old, the death rate can be much higher. Complications of COVID are shortness of breath and pneumonia. Severe COVID can lead to a drop in blood oxygenation levels, and some patients require oxygen support or a ventilator. Mild COVID cases can be treated at home. Monitor your blood oxygen level using a pulse oximeter and make sure it is 94% or higher. For severe shortness of breath, consult a doctor immediately. Number 2, flu. Symptoms of the flu last from 5 to 7 days, including fever, chills, cough, fatigue, and body pain. With flu, people with full recovery in a week's time can get well with just supportive treatment at home. Get plenty of rest, drink lots of fluids, and treat fever with paracetamol. Number 3, cold. Symptoms of a cold are generally milder than flu or COVID. The fever is low grade. You can have runny or stuffy nose, sneezing, sore throat, watery eyes, and mild cough. With adequate rest and over-the-counter medications, patients will get well in a few days. Number 4, allergies. The main differentiating point of an allergy compared to flu and COVID is the absence of fever and chills. You may have itchy throat, runny nose, and a history of allergy in the past. The most common cause of allergies is pollen from trees and plants. Pollen can trigger your body's immune system to release histamines. This will cause runny nose or itchy eyes. You may take an antihistamine tablet and avoid going outdoors in the meantime. I hope my tips give you some clues on whether you are dealing with COVID, flu, cold, or allergies. Taking a COVID test will also help determine if you have COVID or not. Just a reminder that COVID tests are not 100% accurate, so look at the symptoms carefully, then treat the patient accordingly.